Today, Assembly Republicans published a letter calling for an audit of Medi-Cal, and this comes after Governor Gavin Newsom told state lawmakers last month the program is costing more than he originally budgeted for, and now he's borrowing $3.4 billion from the state's general fund to keep it afloat with even more money needed. ABC 10's Becca Habegger shows us why Republicans are blaming undocumented immigrants and why advocates for that community say they're being scapegoated.
Starting January 1st, 2024, California began offering Medi-Cal to all low-income Californians, regardless of their immigration status.
It's really important because undocumented Californians, we pay taxes, we pay into the system.
Carlos Alacon is Health and Public Benefits Policy Analyst with the California Immigrant Policy Center, one of the organizations that led the fight over the past decade to expand Medi-Cal access to undocumented immigrants.
Sickness doesn't discriminate on the basis of immigration, so our healthcare system shouldn't either.
But California Republicans have fought Medi-Cal coverage for undocumented Californians.
We need to put the citizens of our state first rather than financing free health care for people who shouldn't be here in the first place.
Republican Assemblymember Carl DiMaio sent a letter Monday, along with other Assembly Republicans, calling for a state audit of Medi-Cal, saying many are concerned that continued growth in the cost of Medi-Cal benefits for undocumented immigrants is a major driver of the cost overruns. Last month, Governor Newsom informed state lawmakers that Medi-Cal's costs were greater than he budgeted, and that he was borrowing $3.4 billion from the state's general fund to cover the unexpected increase. According to Cal Matters, Governor Newsom's administration acknowledged more people enrolled in the program than the state anticipated, and that the state is spending $2.7 billion more than it planned on coverage expansions for immigrants without legal status. Then, days later, Newsom said the program needed another $2.8 billion to support it through the end of the fiscal year, which ends June 30th.
California faces a complete fiscal crisis in Medi-Cal.
The Assembly Republicans' letter says Medi-Cal is insolvent.
It is not insolvent. That is a gross mischaracterization of what's happened.
Amanda McAllister-Wallner is interim executive director with Health Access California, another organization that has been fighting for Medi-Cal coverage for undocumented Californians. She points out, as does the governor's office, that increased Medi-Cal costs are due to more than just its coverage of undocumented immigrants.
Medi-Cal's a huge program in the state. It covers 15 million people, children, pregnant women, people with disabilities, older adults, covers long-term care, and these things are very expensive.
The governor's office points out increased costs are driven by factors including higher overall enrollment for all populations, not just undocumented immigrants, and rising pharmacy costs. Still, Newsom's office tells ABC 10 the future is uncertain, saying with tough fiscal choices ahead, Governor Newsom, jointly with Pro Tem McGuire and Speaker Rivas, will evaluate proposals to rein in long-term spending, including in Medi-Cal, while working to protect the core health and social services Californians rely on. The administration anticipates state lawmakers will need to act soon to address Medi-Cal cost increases this fiscal year. Adding potential cuts to Medicare on the federal level, a major funder of Medi-Cal, would further complicate the situation. In Sacramento, Becca Habegger, ABC 10.
In terms of the state audit, members of the Joint Legislative Audit Committee will eventually hold a hearing about whether to grant the audit of Medi-Cal. The state's auditor office says that it generally takes at least 6 months to complete the audit work. It is something that will continue to follow.